refractive eye surgery among adults in the United Arab Emirates, and I have no disclosures. So for introduction, refractive errors are very common. It's over 2.2 billion people actually, and about half of these are preventable or undercorrected. But despite these effective options such as spectacles, contact lenses, and surgery, awareness and acceptance remain limited in such regions, and there is no study about that in the United Arab Emirates. And the common surgical options include LASIK, and SMILE. So our aim was to evaluate the knowledge, attitudes, and practices regarding surgical correction of refractive errors in the United Arab Emirates among the UAE adults. So the study design was cross-sectional. The population was any UAE residents or locals above 18 years old who are fluent in English or Arabic. The sampling was non-probability volunteer sampling using social media, and the sample size was calculated using Grassoft formula for proportions. We needed a minimum of 377 participants, and we increased 10% for exclusions. It involved a questionnaire, 45 close-ended questions in both English or Arabic. It was validated using validated CAP tools, and it was pilot studied. And the ethical approval was from the University of Sharjah, and we used SPSS 26 for analysis. So for the results, we had 495 participants. The genders was slightly more female biased. The age was more on the 18 to 25 years, and they were mostly diploma or bachelors, married, and most of them were non-UAE Arabs, and most of them were healthcare workers actually. So for the prevalence, over half of the participants reported having a refractive error, around 54%. Most of that were myopia at 46%. And most of them were diagnosed between the age of 18 and 39. And interestingly, vision correction was used by around 60%, with spectacles being the most common one. So about the overall awareness, 80%, which is a very great percentage actually compared to other countries, showed awareness about refractive surgery. Interestingly, it was mostly from family and friends at 50%, where other university school or ophthalmologists were around 30 to 35. The most familiar procedure was, of course, LASIK at 60%, almost double of other procedures. But yet, because most people don't know about other procedures, they choose don't know as the perceived safest procedure. And the most common complications were dry eyes and undercorrection. So around 50% viewed the surgery as definitive cure, and interestingly, around 27% had undergone the refractive surgery. The main indication was myopia by a margin. And as I said, the most important complication reported was also dry eye. So about the beliefs, 70% believe that dry eye can occur post-surgery, yet 50% believe it as temporary, and only 27% believe it as permanent. The others don't have an idea about that. And around 60% believe that surgery can be done on children, and 40% believe that more than one session was needed. About the perceived effectiveness, as you can see, it's around 75% combined of answers of very effective and effective. That's a good percentage. And only 6% reported seeing the surgery as not safe. So there is some barriers that prevent those who are willing to do surgery from doing the surgery, and there is reasons that prevent those who are unwilling to do these surgeries. For those willing, they did not do it yet because most of them had good current vision, and they fear the complications. While those unwilling, the most important reason was fear of complications and the financial cost. So for the multivariate analysis, as per the gender, males were more likely to use no correction methods, and the 18-year-old group were the most aware, interestingly. So those unaware were more likely to believe the surgery was ineffective, and those who are more satisfied were more likely to advocate for the surgery. As for discussion, that's the first CAP study in the UAE. It emphasizes the need for targeted education, and it aligns with other regional studies but there is need for future research and for more longitudinal research. So thank you so much. It's on PubMed if anyone wants to have the reference.
Thank you so much for the presentation. But one comment.
Yeah.
Spacing between the letters should be more. It's 0.5. So yes. So because when you decrease the spacing, the audience were not going to read. So this is very important when you put a presentation.
Okay. Thank you so
just
much.
a comment for you.
Yeah.
It's a very nice study because means that the awareness about refractive surgery is going high, and I think all of us need to increase the awareness because the refractive surgery is becoming one of the most safe procedures nowadays. Yeah. So during your study, when you ask the people, they are confident in their answers, or they are reluctant or think a lot?
We actually included for every question, we included an option where you are reluctant or I don't know. So those who are reluctant will be excluded from the answer itself. So every answer we have is actually from the people that are confident with their answers.
And the reluctant people was younger or older?
It's actually very well equal from each category. There was no one standing out.
And who did the refractive surgery? When they reply to your questions, they were confident?
Yeah, because again in these questions also we put a non-confident option. So those who replied were actually confident that they did the surgery itself.
Okay, thank you.
Yeah, so first of all, easier questionnaires is very important. Easier questionnaires which you have put, because this is a qualitative research. Okay?
Yeah.
So in your questionnaire, is it been validated with other studies?
We actually contacted 2 other studies, one in Portugal and one made in Iraq. We took their permission to use their questionnaires and change it according to the UAE guidelines. And then we consulted the University of Sharjah Ethical Committee to make any necessary edits.
Okay. Your study has got some important implication of 27% conversion to actually executing the procedure. Okay. Now, why 27% when more than 80% is aware of the surgery?
Yeah.
Now, there is a difference. The most of the awareness are from families and friends, so 80%. But 25% or 26% is from the doctors. So there is a good implication here that the medical fraternity need to improve the information correctly to the patients. So there is important information where
the public health needs to be tailored according to the UAE.
Yes. So that needs to should be in the conclusion as well.
Yeah, sure.
Yeah.
Thank you.
And thank you very much.
Thank you so much.
Very good.
Thank you.
May I request the next speaker, Moazem Parvez?
A very good morning to this august presence.